parties afterwards. So just so everyone's aware. So if you could start the recording, Phil, let me know when it's going.
Started it.
Perfect. Thank you. All right. So thank you everyone for coming today. I was trying to think of an introduction yesterday while cooking about kindness. I'm so interested in what you're going to say, Nicki. I was just, what struck me is thinking about kindness is that we rarely, as adults, I guess, think about it so much. Like, I've got 2 young kids, and all their stuff on TV shows and books and things is so much about kindness. It's so important as a thing that we teach kids that you have to be, and then we sort of it's talked about less and less, and all the heroes of grown-up things tend to be people who can in films who can punch the hardest or whatever, which is really odd. So that's what I've got as an intro. But thank you, Nicki contacted us, has come all the way from New Zealand, so we're very grateful to have you here with us today, and very excited to hear what you have to say. So I'll hand over to you.
Oh, thank you. Kia ora everyone online, and kia ora koutou to you guys. Thank you for having me come and talk. I love talking kindness, and I have planned quite a lot for us to get through in this hour. So I'll try and move quickly. I do tend to geek out about this stuff. So thank you for giving me the opportunity to do some collective geeking out. Who am I? My name is Nicki. I do come to you from New Zealand. I'm attached to the University of Auckland, where I've just submitted my PhD in organisational kindness. What led me to the PhD? Just really messy life. So I am an occupational therapist by background. I did some public health training and ran the quality improvement program for a primary health organisation in New Zealand. I then partnered with a GP as a patient, and we designed a service that was trialled and ran in New Zealand for a couple of years. We showed that through one extra person in the care team, that whose role it was to show extra kindness and caring to our enrolled primary care patients. For 12,000 patients that had access to the service, we managed to save the District Health Board almost 2 million New Zealand dollars, which is almost £1 million, and reduced rehospitalisations, readmissions. So I kind of got this professional sense that kindness mattered. And then what happened? I had my babies. This one on the screen here was born with some pretty gnarly medical and nutrition issues. At this same time, my best friend, my dad there, was diagnosed with terminal cancer. And so I'd had this professional background and sense that kindness really mattered. And then we got thrown in the deep end. And I sort of developed this curiosity. Our experience of kindness in the palliative system versus an acute paediatric setting was quite different. And it gave me my first real taste that perhaps it's not as simple as we make it seem, in terms of everybody can choose kindness and everyone should just be kind. Actually, we've got these systems that get in the way or can encourage us. And so became a patient advocate, got a bit tired of beating the drum outside the village gates, and so I chose to do the PhD to get inside the institution and start opening up some doors for fellow advocates and people like us. So that's me, and that's why I'm here. Today, I'll spend some time talking with you about what kindness is, almost as importantly, what it isn't. And then I'll take you through some of the work we've been doing around building the evidence base for why kindness matters, trying to tie it into some metrics and strategies. And then I'll briefly take you through the research approach that we've used to start building evidence for the conditions for kindness. So knowing how important it is for what in our systems helps us at an individual and teams level to show kindness and to act with our values at the heart of what we do. So what is kindness? Early on in the PhD, I recognised that actually there isn't an existing definition of kindness in our healthcare literature. So I dug and didn't get anywhere. The literature often confuses kindness with compassion and empathy. That's fine in a sense, and I have been accused of being pedantic, except that we have all this leadership evidence building for empathic leadership, compassionate leadership, kind leadership. They all actually mean slightly different things. And so if we want to push research forward in terms of measuring these phenomenon and implementing them in an active and meaningful way, we need to know what they are. This is really important because in the mainstream, especially in the last 5 years or so, post-COVID, in the media, we sort of have a lot of narrative around kindness being actually a bit shit. So weaponise kindness. We have narrative around kindness being used to coerce and control in terms of people's free speech, whether or not they express dissent or dissatisfaction with their leaders or their workplaces. That's not what we're talking about here. That's not kindness. On the flip, especially in social media, we have some really toxic messaging around kindness. This whole just be kind, nothing else matters. Have to call that out. That's not correct. It's also not a case of it always being possible to be kind in every situation, nor should we strive for that. So how did we get to the work of defining kindness? We started with a scoping review, which I'll explain in a second. The scoping review established really clear definitions for empathy, compassion, and kindness, which was helpful, but it just didn't quite hit its straps for us in terms of our experiences working alongside healthcare teams and with experts of kindness. And so we built on that with implicit knowledge generation. We did a survey with healthcare professionals and then did a series of 15 qualitative in-depth interviews with who we call champions of kindness. So that involved patient advocates, researchers, policy analysts, people from outside and inside healthcare across the world. The scoping review found this. This is quite geeky, so I'll try and summarise it quite quickly. So we screened 1,300 and something articles that attempted to define compassion, empathy, and kindness in the literature. We chose some comparison terms simply because they were getting confused in the literature, but also you can best understand something by standing it alongside other similar terms. And this is what we found. So full text analysis on over 100 articles. We included almost 50 articles in the final scoping review. Empathy, compassion, and kindness are different, and we came up with this visual depiction to try and make it really clear. So empathy is very strongly a stimulus. It's an internal process. It does not, and no one in the literature tried to equate that directly to action. What it does is give us a stimulus, which we then respond to with empathy, and that helps inform actions. But there's no such thing as an empathic action. It informs actions of compassion or kindness. Interestingly, it doesn't always inform action. So if we're walking down the corridor and we see Andy being very rude to Tom, we can observe it, we can feel it inside, we can say, gee, don't want to be Tom today. But when we walk past and we don't follow up or with either party, then we're choosing not to act on it. So we can feel the empathy but not act. Side note, not included in the scoping review, but actually bullies often have really high levels of empathy. It's what they do with that knowledge of the other person. They just use it maliciously rather than pro-socially. If we experience too much empathy, and this happens in our healthcare workforces, so surrounded by suffering and stress and poor workplace conditions, the waves of empathy keep on coming, and eventually we get to a point where we start drowning. So it's often referred to compassion fatigue. We lose our ability to act and respond appropriately, and we start to put up some walls to try and cope with the flood of empathy that we're experiencing. It's really damaging, especially long term. And as a result, we have a workforce globally that over 50% of us suffer from burnout symptoms. However, if we're in a good shape with our empathy, we can choose to respond with compassion. Compassion in the literature is really, really strongly linked to suffering. The root of the word is to suffer with. So when we feel compassion and choose to act informed by compassion, it's in response to witnessing another person's suffering and a desire to alleviate that suffering. Again, really interesting in the literature, many of the authors examined didn't actually explicitly link it to action. So it's very much in the emotional realm. It's not often a cognitive response, it's an emotional empathic stimulus to suffering. Kindness, however, and this is why we're backing kindness, is what we need in our healthcare system. Kindness can be emotive, so it can be an empathic response. However, it can also be a cognitive choice. So we don't always need to have an empathic reaction. Kindness is very strongly action-based in the literature, so it's not a feeling. It's judged by the actions that we show outwardly. Kindness is very strongly linked into the concept of flourishing, which means that we're choosing actions to support, to elevate, to help other people to grow. Actions that are really strongly linked into the concepts of respect and dignity. So it's how we demonstrate care, how we demonstrate concern for other people's dignity, and how we preserve their respect in our interactions. It's not grand gestures. And so again, in our mainstream media, we have lots of sort of popular, like these random acts of kindness, people giving $100 to homeless people or buying people meals. These things go viral. That's not, again, it's not what we're talking about with kindness. And I think that version of kindness is really intimidating because people start thinking that they need to have a lot of resource or they need to be really grand in their gestures. Actually, when we're talking kindness in healthcare, it's a small everyday actions. Again, it's about showing care and respect and concern for people's dignity. It more often looks like the bottom picture there. And again, it's small acts that have a disproportionate impact. We know this from the qualitative research, and generally as humans, we know this when we receive small acts of kindness and moments of vulnerability, it means a lot. So just to finish off, very much action-based. It's motivated by a desire to support or elevate another person. So we're talking about flourishing. It can be chosen proactively or it can be reactive. That makes it unique to compassion or empathy. It does not require suffering to be present. So it's not just about this kind of restoring people to baseline. It's actually more concerned with how we move people beyond baseline to be better than before. Finally, this was not in the literature, but it came through very strongly with our surveys and our interviews. Kindness is not niceness. There are some really key differences. Firstly, when we're trying to be nice, it's often motivated by agreeability. So we want people to like us. We want to be seen as the good guy. It often involves turning away from having difficult conversations or challenging people's behaviour. We don't want nice people in our workplaces. They, especially not as leaders, they don't get stuff done. We actually often don't respect our nice people. We have more respect for people who show vulnerability. We often have more respect for the people that, excuse my language, but call bullshit when we need that happening. what we've found with our surveys and interviews is that conflict is a really key tool for kindness. So often we use conflict to make space for kindness. So if one person in the team is falling below the expected group norms, when we engage with them and we challenge them, it's out of a collective concern for the success and comfort of the team. And so you're still acting with kindness, and you're still acting because you want to see that person be their best. And really key, I read a report published last week that talked about characteristics of leadership. They identified agreeability as one of them. Strongly disagree with that, and on that we don't need to agree on everything. That's not what kindness is. We don't even need to like each other, but what we need to do is commit to showing concern for dignity and respect of one another. So we don't need to agree on everything. We can still be kind to one another. And just before moving on, there's some really key concepts that sit side by side with kindness in healthcare, and we're working hard to formally blend these together. Have you guys heard of psychological safety? Hard not to these days. And have you heard of social capital? That's one of the more obscure ones, but it's picking up steam. So social capital is the resources generated within an organisation that happen through the relationships of the people. So it's the magic in between people that happens. It leads to better sharing of information, more willingness to collaborate with one another. It often means that we don't duplicate efforts or use unnecessary resources, and leads to working together to accomplish shared goals. It references the relationships both within teams like yourself, as well as how you work across teams and across organisations who share similar mission objectives. Psychological safety is really around how people feel in their workplaces. It's a belief that they can speak up or share ideas without being judged or disregarded or punished. And when we have workplaces with really strong psychological safety, we see that people, they turn up, they're really engaged and motivated to do their best work, and they want to share ideas and contribute to the organisation mission. Tom Lee and Amy Edmondson, they're kind of the pioneers of these two schools of thought. I've been really fortunate in that the three of us have been working together to tie kindness, psychological and social capital together. We're hoping in the next month or so that the Harvard Business Review will publish an article that we've written together to tie these concepts together, because we really believe that rather than standing apart, a healthy and high-performing workplace have all of these concepts in motion, and it's like a virtuous circle. So watch the space on that front. And this, you can tell I've got a teenage boy in the house. This is a really great way to think about kindness. It's really how you use your knowledge, your skills, your time, your support, how you include other people. Are you using it in a way that shares power and includes people? Or are you withholding some of those things to maintain hierarchy, to keep people in their lanes, but potentially also curtail their potential in the workplace? We're all, I don't know that any of us can claim innocence, and sometimes we all use the dark side. It just happens, especially if we don't like people. So part of building kind cultures is being a bit more mindful about this stuff and doing a bit of self-reflection when we slip up. Right, so why does kindness matter? I think we all know in our heart of hearts that kindness is a good thing, but actually it's really getting really strongly tied into some great organisational metrics now. Often we talk about the dark side of kindness or the flip side of kindness, so that's where a lot of this evidence comes from. So if you can just work with me to try and flip some of these stats around. Incivility, we consider the opposite of kindness. Incivility is not bullying, it's garden variety rudeness. So, it's in the meetings when someone sniggers or rolls their eyes or does the little head shake. It's when we approach someone and they actively turn away, or people chipping at us, making little comments that often they're not even actions that we can necessarily call out at the time. We just have the sense that it was a bit on the nose. Incivility is really pervasive and it's a big problem. So what happens when people are rude at work? This comes from Civility Saves Lives. Do you guys know of this website? It's a great place to go for resources. It's a UK-based organisation, so it's awesome if you need some evidence. This comes from them. So 80% of recipients will decrease their productivity through worrying about those rude interactions. 38% reduce the quality of their work. So they stop striving to, use their initiative and they just start flying under the radar so that they're not a target. 48% of us, so half of us, reduce our time at work. So that's either slacking off early or taking sick days, starting to try and push for more remote days so that they don't have to have those interactions. So if you start seeing sort of a steep increase in people wanting to work from home, even though it's not the organisational norm, sharp increases in sick leave and time off, this is kind of a flag for your culture. It's not just the targets that suffer, so witnesses also decrease their performance in terms of productivity and effort. And show less willingness to collaborate because it doesn't feel safe to collaborate. And the service users one, it really resonates with me. So I mentioned I became a patient advocate because of our own experiences in the healthcare system. A lot of them were really positive, but many of them were not. There were some instances of unkindness that have caused long-term impact for our family in terms of our daughter's outcomes. And so it's really serious stuff. And what I'd say there, and why I've chosen with my PhD to focus on healthcare workforces rather than the flow of kindness out to patients, is that for us, it wasn't so much kindness directed or unkindness directed at us as a family. The stuff that really eroded our trust and made us anxious was when we saw our healthcare teams treat each other with incivility. So if people undermined each other or didn't share vital information about our daughter's care, it made us really, really unnerved. And it's very difficult to then pass your baby off for a medical procedure if you don't feel that people are working together well. It's quite harmful. Really good study came out about 18 months ago that collated a bunch of studies. So this represents sort of thousands of different adverse event and mortality cases in hospitals in the English-speaking world. Incivility was associated with 67% of adverse events in hospitals across the Western world. 70% of medical errors look at that. 27% of mortality and incivility could be found to be a root cause of avoidable mortality. And if you're a manager or a leader, this one should speak to you and perhaps resonates with your experience. This study, fabulous study, looked at managers inside Fortune 1000 firms. On average, middle managers up and executives spend the equivalent of 7 weeks a year dealing with the fallout from incivility amongst their teams. So 7 weeks a year dealing with squabbles and trying to repair relationships to a point where people can work together to achieve the organisational objectives. So if you take an organisation like the NHS and you think about how many managers and executives the NHS has, and then you do some math around if every one of them is losing an average of 7 weeks a year dealing with incivility, you can see that this kindness stuff really has to become a strategic imperative, and it has really strong links to financial and human resources as well. One more stat, and then I think that's it. Again, after COVID and the Great Resignation happened around the world, people were leaving their jobs in droves. There are a whole lot of studies that came out looking at why that was. The base assumption being that it had something to do with compensation. Essentially, people are like just not getting paid enough to deal with this stuff. But actually, the organisational culture was, if it was toxic, it was 10 times more likely to be the reason why people left their jobs in search of another. So again, that ties into our financial resource and healthcare organisations. And as we all know, there is a problem at the moment. There's no magical pool of resources coming our way anytime soon, anywhere in the world. So we sort of spent the first half of the PhD looking at this definitional stuff and why it matters. And then we found, again, there was just really very little evidence to inform what we do with that information. So how do we turn that sort of really academic stuff that I've just been geeking out about, how do we turn that into action that's useful and meaningful for our organisations? Because this is the juicy stuff, right? This is actually what counts for your average team. So there wasn't a lot in the established literature, so we had to start getting a bit creative, recognising that having done the literature, reviewing that it's not simple and it's not a case of just telling everyone to be kind. It's really, really complex out there. Again, having a little bit of a dig around how organisations are currently trying to build their organisational culture and embed kindness, we found it a bit hit and miss. Here is an example on the left of one of the NHS responses. So I can't remember which trust this came from, but your wonderful staff wellbeing survey that you do, which we use in New Zealand and other places as our own evidence. Half of the workforce felt very or moderately burnt out, and this trust's response was putting in place a dealing with burnout course. Now, on the surface, that seems like a really good idea, but actually if you think about the messaging behind that in terms of it being an individual responsibility to adjust to the system that they're working in, even though the system is making half of us sick, you start to sort of wonder if we're really hitting the right notes with that kind of response. Marie Bismarck lets me use this tweet from a couple of years ago. So Marie is a psychiatrist on our side of the world. She writes here, our consultant vacancies are still unfilled. We will not have a registrar for the rest of 2023, which at that point was 7 months, leaving her as a sole part-time practitioner for a population of more than 50,000 people. And she's gone, the organisation has given us a worry tree to cope with the stress. Now, I think this worry tree originated inside the NHS. But I hope you can read the small print there. At the top it says, what am I worrying about? Is there anything I can do about it? And we would argue that no, Marie and colleagues can't do anything about that sort of situation. And so it says, let it go. Let it go, Matt. And then change your focus of attention. Just stop thinking about it. Cool bananas. It's actually a really harmful message that we're sending there. And it does diddly squat to help people like Marie. I believe Marie has moved on now. So yeah, looking at some of that, again, the free pizza lunches, the mindfulness seminars, the yoga lunches, the meditation sessions. it all shows a concern for wanting to make things better for our people. But what we need to understand is that it's not even scratching the surface. This is a systemic problem. And having a free pizza lunch is not going to create any sort of change. And actually, don't bother, because the messaging it sends that we can fix these things with such superficial approaches is more harmful for our workforce than not doing anything at all. So we wanted to understand for healthcare teams what meaningful action would look like for them. We also needed to gather some information about what the conditions for kindness look like across levels of an organisation. So if we accept that kindness is complex and requires a multi-level response, then we needed to start gathering evidence at the different levels for what would help people to sustain kindness inside organisations. We went a bit old school. This is not used heaps in current research, but really spoke to me as a past patient advocate and a bit of a scrapper in terms of advocating for inclusion of different voices around the table. We came up with a modified expert panel to figure out what the conditions for kindness were. So a modified expert panel is really just a structured group discussion that involves individual and collective reflection, as well as round robin processes where people contribute their ideas. I don't like the term expert panel, and traditionally these have been used with what the institution would define as expert, so your highest level leaders and executive. We redefined expert as people with lived experience, and so we called our participants experts, but made this really clear. It does involve a bit of a Delphi method, where you use Likert scales and you're trying to get collective consensus on what matters to the group. It's informed by participatory action research. I'll skim through this because it's probably not something that many people get excited about, but to understand the approach that we used, these are the things that really mattered to me as what I call an accidental academic. So again, coming from an advocacy background, I wanted to embody research methodology that demonstrated democracy, respect, inclusion, some of the things we'd associate with kindness, and involved generating knowledge not to sit inside a medical journal, but to actually inform change for the people that were involved in the process. That was really important to me, that these participants actually got something out of it too. So there's lots of benefits. I'm looking at the time, I'm actually going to skim through these, but really in terms of the research benefits, using a participatory process like this, you develop knowledge of kindness in context. So you're taking it out of the explicit knowledge world and really trying to understand the complexity of what it looks like in real life. For our workforces that participated in these panels, we found that they really thrived on the inclusive style of the research. We found that the team really enjoyed the process because we used an appreciative inquiry approach, which is not talking about rudeness or bullying, but talking about who we want to be and what support we need to get there. Our teams went forth and reported experiencing better relationships with one another as a result of going through the research process. So the process was kind of a meaningful journey as well. This is what the data looked like that came out. I don't know if everyone can see that well, but people did individual reflection, group reflection. Everyone had a chance to contribute their ideas for conditions for kindness at different levels. So this one shows when we got to the organisational level conditions. So as people contributed their ideas, I'm sitting typing it into my computer, projected onto the screen so everyone can see each other's contributions. The end of the session, they rate these conditions that they've collectively generated in terms of importance, what really matters to them. The other thing, sorry, I should mention, these expert panels, we purposefully sampled vertically throughout the organisation. So we had people from admin and support, we had junior doctors, nurses, allied health, senior medical staff, leadership, and board members when we could. So we purposefully tried to get multiple perspectives and seniority and adjust for hierarchy through the organisation. So people rated the conditions that they've collectively produced, and you can see there for these ones here, there was not a lot of deviation. So these had a really strong consensus of mattering no matter your place within the organisation. Each level sort of had 24, 25 conditions. Some had much more deviation, which shows that, you know, depending on where you stand in a team, some things matter more than others. So that's the sort of data that we ended up with. And again, magical way of turning qualitative data into quantitative. Quantitative is not the end goal for a lot of us in social science research, but what it does is build the sort of data that organisational decision makers need to see to start making real changes. Again, just the research really highlighted that we have to move beyond individual responses. We have to stop putting the onus on our individuals to just smile and get through it and remain unfailingly positive and not talk about how difficult it is. That's really harmful when we insert that sort of approach into our culture. Oh, sorry. Research showed, and we'll dig a bit deeper, we have to stop medicating the fish. It's not enough. So we need to stop throwing resources at medication and band-aids. If we want to change the system and create sustainable change, we have to clean the tank. We have to really sort of drill down into our leadership and our governance approaches to how we embed kindness as a strategy. So this is what the research found. So this knowledge was co-produced with our healthcare teams. They're not people that had spent a lot of time navel-gazing around the importance of kindness. That was my role. And this is really what we came up with across the different teams. So yes, there are individual level conditions for kindness that are important. We do have control over our behaviour. We do need to seek opportunities for reflection, both formal and informal, to understand our own biases and to reflect on how we treat other people. It's that light side, dark side stuff. But we do need system support to do that. At a teams level, group norms came out really, really strongly. This isn't hugely present in the literature. We'll be changing that in the next year as we publish out of the thesis. Group norms are really important for people. So they want to be in teams where there are established and healthy group norms, and they want leaders who control those group norms and maintain them. And they do firmly put that as a leadership responsibility. Again, that opportunities for team reflection, but also knowing both ourselves in terms of our biases and our background and how that influences who we are as people, wanting to know that about our teams as well. So real curiosity about this, you know, what makes us human. Again, we need the system support, but the most important conditions and the ones where we got the most consensus was at an organisational level. So what does your governance look like? So how are your organisational values made explicit and shared amongst the organisation? What do our artefacts look like? So that really surprised me. People were talking about wanting to have explicit mission statements and values guides produced by their organisations. Leadership was really, really key. We'll do a little bit more around that. The idea of organisational culture, aspects of psychological safety in particular, and to have organisations that are resourced to support opportunities for connection and reflection at both team and individual level. So our key findings. I like this one. We're almost at the British summer, and I feel that I can now relate to this so much more than I ever have before. I had to buy a coat once I got to Europe because it's so cold. One of the key findings, kind systems allow us to be ourselves. So we want to work in workplaces where our personal values strongly align with the organisational values. So this came out as really, really important, and it's not strong in the literature yet. We really want to know that we're allowed to live our values at work, and that the values that our workplaces hold dear and explicit are ones that we share on a personal level. These slides are maybe a little bit mixed up, but this is again what our research found. So there's different levels of what we need at work to be our best. I won't go through these one by one, but essentially we need to feel like we belong in the team, that we're safe to speak up, that we're safe to be ourselves with all our differences, and to be included regardless. We need to feel cared for, and we need to be respected, and appreciated for our contribution to the team, no matter our place in that team. We want deep and supportive relationships. This is actually where we find our joy at work for most of us, is in our relationships with those around us. We obviously want to be respected, and we need to feel trust. And I heard in the conference last week that I attended, someone describe trust as coming in on a tortoise and leaving on a hare. It takes a long time to build trust in a team. It only takes one or two muppets or one or two negative interactions, and the trust is broken, and then you start the slow process of building it up again. Again, this is something for leadership to really reflect on, I think. And organisational structures. The leadership, if you have to back one horse, and in a world where we don't have infinite resources and we do have to choose our priorities for intervention, if you had to back one horse, I have to say it has to be our leadership capability and development, not necessarily with our senior leadership, but the next generation. For some of our senior leadership, they've had years in the institution. It's possibly going to be harder to change in a sustainable way, but what we want to bring our emerging and next generation leaders. We want to bring them into a world where they view kindness as a professional competency and a skill that they need to reinforce both in themselves and others. Again, leadership is the bridge between strategy and culture. This was really strong in our expert panels. Leadership is the key. And on that, this is my wee girl, 2 sides to her. We need to start treating kindness as a skill. It's not a feeling. It is a professional competency. And if we can accept that, then we can learn it, we can teach it, we can expect it from those around us. We can bake it into our education, our induction processes, human resources, our promotion competencies. So this is really key. On that, how are we going for time?
15 minutes or so.
Yep, good. All right, we're almost there. Sprint to the finish line now. We did some characteristics of what people consider to be kind leadership emerged in the expert panels. These are backed up somewhat in the literature, but we're certainly excited about, contributing to further that evidence base for good, kind leadership. So this idea of honesty and also conflict are really key in terms of what makes a good, kind leader. This idea that kind leaders engage with conflict. We don't turn away from it. We make space and we prepare for the difficult conversations we have to have. We give people feedback that they might not want to hear, but is essential for the success of the group and to build social capital. Leaders really are accountable for group norms. You can't rely on this being a bottom-up approach. Kindness, if we want to bake it into our organisational strategy and culture, it has to be top-down. And this is hard for a Kiwi to say. Kiwis are famous for our grassroots approaches and, you know, leading from the bottom. This has to be top-down. It's not enough to expect individuals to just keep going forth into systems that burn them out and render them not able to realise their full potential. Leaders encourage psychological safety, again with the honesty. Role modelling is really important for this, so both showing vulnerability, but also, you know, sharing and accepting other people's ideas. We need to use kindness strategically. In the kindness world, this would horrify some people, including colleagues that I work with who still, you know, there's a train of thought that kindness is inherent, that we're born kind. It's, you know, the essence of us. I agree to that to some extent, but I disagree that that's at full stop. It's like saying that leaders are born leaders. There's many leaders out there who, through good investment and good role modelling, become amazing leaders who may not have been born to that without meeting the right people who want to elevate them and support them. So we do need to start using kindness strategically, and I don't think that's a sellout to say that. If we can link it to organisational metrics, as we just have, then we need to invest in our leadership. This Benjamin Laker wrote an article spotlighting the scoping review that we did for Forbes. This was really thrilling. And again, just there's a real momentum, especially in the last 6 months or so. People are starting to recognise kindness as a strategic imperative. And so at the conference last week, which was the BMJ Quality and Safety Conference, kindness was a buzzword. We don't need to treat it as a buzzword, but there's growing recognition that high-performing organisations value and invest in organisational cultures that reflect kindness and psychological safety. And finally, I said before, Tom and Amy and I have been writing an article for Harvard Business Review. Because it's under consideration, I can't put the words on this slide, so I'll just read out we identified 6 key levers for how we embed kindness into organisations. So number 1, we do define and embed kindness as a strategic norm. Number 2, we assert and train for kindness as a professional competency, non-negotiable. It should be an expectation, and on the flip, we actually need to start sort of reinforcing that, so taking action when people fall below our expectations. Number 3, group norms, really important. We have to assert and establish group norms as leaders, and we need to start finding ways to formally measure kindness. So as I sort of alluded to, there's actually good data in terms of workforce engagement, job retention. We can look at things like sick leave, productivity, adverse events. We can start to link some of these hard metrics to kindness, cultures of psychological safety and social capital. We need to start work to do that. And we need to make our managers accountable for kind culture. And again, we really need to get rid of this idea of random acts of kindness. If we want kindness to be systemic, it should be treated much like we used to treat hand washing back in the day. So, you know, we need to make it an expectation that we enforce. Finally, if you take nothing else away from the presentation, the good Kiwi rule there, it's used by the All Blacks. Don't be a dick. And if you're not being a dick, you're halfway there. Right?
Fantastic, thank you. If you choose stop sharing on the thing, we should probably be able to see everybody. There we go.
Hello, everybody.
Most people have cameras off, but they're
Oh, there's some chat happening.
Yeah, there's some chat. Yeah.
Oh, sorry, should I?
So no, that's okay. Are you okay for some questions for just a couple of minutes? I don't know if people want to put their questions in chat or put their hands up, however.
If you ask them, that will be easier than,
Yes,
than scrolling through the chat.
Indeed. So if anybody wants to, anybody have any questions? I have loads, but I'm also aware that we're having lunch, so I get to ask them then. Phil, do you want to ask a question?
Yes, thanks very much, Nicki. That was really interesting. I think, it's quite a lot of it resonated with me. I've had some managers in the past who the idea of kindness was, when I got divorced, was you can have Wednesday afternoon off, but you will be back tomorrow, won't you?
Yeah.
So yeah, but what I was going to say was, obviously, there's been a much bigger focus on mental health since COVID and people's well-being. But I've noticed in recent times there's been a massive shift as, like, if you do need kindness or anything, you're a snowflake. Have you seen this sort of in the research that you've done, that people are scared to ask for kindness or give kindness for fear of being labelled a snowflake or weak?
Yeah, and we certainly have, Phil. And again, our mainstream media has a lot to answer for in that regard, but also, again, that a lot of that comes down to organisational culture, and that's where the role modelling and being really explicit with group norms comes into play. But yeah, I mean, that's a pervasive problem. We're trying to work really hard to fix it, and that's one reason why I'm so hard-nosed about kindness being a professional competency. We need to work really hard to move it out of the soft and fluffy. Traditionally, kindness has been treated as a discretionary approach. It's often linked to arts and music, and that sort of really creative sort of celebration in a workplace, your bake sales and your team morning teas and stuff like that. They're great, but I think the time has come to be really hard-nosed about it.
Yeah, thank you. And just in case my appraisal hasn't been uploaded yet, the management at HEU are all wonderful and very lovely.
Can I ask a question, Nicki? Is there any, not even necessarily in healthcare, but any organisations or people or leaders that you've seen where you think they're sort of doing it right or on the way to doing it right in the way that you've kind of outlined?
Yeah, so there's lots of examples of people trying.
Mm-hmm.
And before I answer that, actually, for those on the call, if you are interested in some support around this stuff and finding your tribe, if this really speaks to you, there's a network that's based in the UK called Conversations for Kindness. So we meet monthly online. It's a global network. So there's over 40 countries that participate, 3,500 members. Usually about 100 turnout, but if you want a little dose of support for living your values as both leaders but also as followers, then let me know, send me an email, I'll link you into the network. And yes, there are some great examples on both sides of the world. Here, Bob Klaber at the Imperial College Network is the master. So he has baked it into his induction processes with his junior medical staff that turn up for placement at Imperial. So he gives them a jolly good strong talking to around kindness and expectations for conduct at Imperial. I think that sort of stuff is really what we need to get better at. Yeah.
I think there was a question in chats that the person couldn't get their microphone to work.
Oh, okay. Let's go up. I cannot put my mic on. Oh, hi, Julia from Switzerland. Hello. What to do if there isn't a word that equates to kindness in other languages? Yeah, I mean, I don't have the answer for you, Julia, but it's a really good question, and is something that we explicitly acknowledged in our scoping reviews, that we could only approach our review with English-based studies. A, because we don't speak any other language, most New Zealanders don't, but B, because there is some of it is lost in translation. I'd actually love to see a study that looked at the treatment across cultures. So I can't answer your question. I'd be happy to nut it out with you offline if you like, or put you in touch. I've got Scandinavian friends and European friends who might be able to help you with that.
And Nicki, so we've learnt about kindness from Bob and Dom, because we were all the unit originally started at Imperial. So this and again, and for us, all of this kind of makes sense. Yes, it all seems very, and that very much don't be a dick is the bit that kind of I think really landed with us. And we operate delegative leadership at the Hugh, the idea that people should feel autonomous. So then kindness kind of goes, I think, cheek by jowl with our delegative leadership. What kind of, we talk about kindness as a strategy. What kind of things, what kind of simple day-to-day tactics, what kind of things would you expect people to be doing to demonstrate kindness during the day? So what does kindness actually look like in its kind of physical, emotional, that thing that we do to each other?
Yeah, I mean, I could give you hundreds of examples, but I think we do all know when we're receiving kindness. It's you know, actions that make us feel respected and cared for, and that people are including us. I do think a lot came out around this group norm stuff. So a commitment to one another to maintain healthy group norms. It's the little stuff like that slide, you know, at the start. It's not grand acts. It's small everyday interactions and actions that really make the difference. And also, you know, on a practical level, something that came out of the expert panels was people want to have really clear boundaries around their roles and responsibilities, but they also want to feel comfortable to enforce boundaries with others when it comes to time or when the interactions happen. As leaders, we can role model this by setting our own clear boundaries and not being the knight on the horse that has to gallop in and save everybody. Sometimes we need to give people some space to fail or to figure things out for themselves. I don't know if I answered your question. But yeah.
No, thank you.
I'm sorry, actually, that was a really interesting talk, and I actually wanted to try and think about how it applies to the UK and healthcare here. And the NHS is obviously a very large organisation, and particularly your advice around it should be behaviour that's modelled by the leader at the top and then kind of cascades down. It's quite difficult to do in the NHS given there isn't a leader. And
Yeah,
so what's
I mean,
the advice that you'd give around that?
Yeah, and I mean, really, it's not just your leaders at the top. You know, it's the whole hierarchy all the way down. And yeah, I think, you know, every leader at every level has some power and influence over the people in their team. It's going back to that light side or dark side, it's how you use it, but really feeling that as a responsibility. If you have people below you, taking that commitment to both role modelling, but also demonstrating consistently respect, appreciating people, helping support people to kind of hit their straps with autonomy and development. Yeah, don't know. Yeah, it's not just your leaders at the top, but for a leader, a middle management leader, to be successful at sustaining this sort of role modelling and commitment, that they need a leader who's committed to sustaining that.
Yeah, so I guess a leader throughout the system, wherever they are, even at the grassroots, can kind of model kindness, and it's a separate question that's a lot more difficult in terms of how do you cascade it through the whole organisation.
Yeah, like if you're a leader that's committed to that, but you have your own leader or manager who is not creating the sort of permissive culture for you to lead that way, then you're poked. And so it really has to come it's a trickle down from the top.
And again, I think we saw this with Bob at Imperial. Bob wasn't the chief exec. But no, he was a director, and I'm not sure if he was even on the board, but everyone, so even our sister unit, so we weren't part of Imperial College, we were the health partnership, and we all knew about it. So I think that again, Bob and Dominique Orwood, they managed to get this message across, and clearly their senior leaders weren't against it because it became pervasive. I don't think anyone at Imperial didn't know about it.
That's right.
And so there's one group of very senior people who managed to make everyone understand it and follow it.
And again, Dom has just had a promotion. I think she's now the chief exec
of the health partnership, where funnily enough, me, Tom, Wayne, well, in fact, nearly all of us from the unit used to work originally. Yeah.
And you know, she's key in our kindness movement, and so again, you know, that's lucky, isn't it? But that's we need more people like that, sort of reaching those levels, and that comes through valuing kindness as a professional competency and taking it into both technical and clinical skills and time in the job, valuing that sort of thing as well when we're looking at who we're promoting.
There's another one in the.
Oh, is there another one in the chat? Well, there was one of David saying thank you very much, and he's currently working with the King's Fund on a project around organisational anxiety, and he will link you in. So I know you were just there the other day. So in fact, David may not know that they know about you, but at least we can connect you again for that.
So David, I played intern at the King's Fund the other day, and I love them as an organisation. So anything I can do to help you, I would be more than happy to.
We can connect you. David runs our sister unit, their strategy.
I see that. Yeah.
Cool.
So I think we've
Okay, yes, we have reached time. It seemed like we talk about this because it's so interesting. So thank you for pages. But yeah, thank you very much, Nicki, for sharing all of that. Yeah, and now I will quickly over lunch.
yes. Well, you've come all the way from New Zealand. We can at least buy you a salad.
Yes. Thank you everyone for joining us online. We'll share the
Thank
recording
you.
for those who want to go back and see more. And if you have other questions,
Please
you're
reach
okay.
out.
Yeah.
Please reach out. Lovely to connect with any of you and all of you.
Okay. Cool.
Thank you.
Yeah, thank you everyone for joining.
Thanks very much.
Bye.
Thank you.
Bye bye. Oh, I love this little